I'm Dr. Mike Milligan. I'm here with Dr. Kim Kutsch from Albany, Oregon, developer of Carifree. Kim, thanks so much for being with us.
Hey, thanks, Mike. It's a pleasure to be here with you today.
Wonderful. Well, Kim, tell us an update on Carifree, and now you're into behavior modification to help those patients actually change their behaviors so that they really get the total benefits of your products.
Yeah, well, you know, Mike, I started on this journey probably 12 or 13 years ago, and I was really frustrated that patients were doing everything that I had been trained to tell them to do.
Right.
I was doing everything I'd been trained, and they continued to get tooth decay.
Right.
And so I really went about trying to figure out a better way to do that.
And you did.
And I did, yes, and it does work.
And we all in dentistry and patients and around the world, thank you for that.
Oh, well, you know, thank you for sharing that with me, because I tell you, it's why I do what I do,
right.
Trying to, you know, end the suffering from this disease.
Right.
But, you know, we worked on diagnostic models, you know, risk assessment based care, helped develop a biometric for the disease, right. And then started working on products and therapeutic strategies that would be effective for patients.
Right.
The last piece of the puzzle for me was they needed to maybe make a behavioral change in their life to become healthy.
Yeah.
Like I could hand them the best rinse that I could conceive of,
right.
And if they wouldn't go home and use it and incorporate it and make it part of their habit,
right.
We wouldn't get any effect out of that. Right. So, or if they needed to change their diet or change their home care behavior. So really the last piece of the puzzle for me was I didn't have those skills. As dentists and hygienists, we're not trained to help somebody make a behavioral change.
Right. So let's back up just a second before we get into that final piece. Let's talk about the earlier pieces. So you learned that pH was a significant factor in allowing the pathogenic bacteria to thrive or not.
Yeah.
So just briefly touch on that for me.
This is really, I mean, dental caries, we always think of it as being a disease of mutans streptococci and lactobacillus. That's what we were taught.
Right.
But at the end of the day, this disease is really a biofilm disease with multiple pathogens, and it results from prolonged periods of low pH in the mouth, which result in net mineral loss. And so you have these bacteria, either too many bacteria or they're behaving badly, creating these long periods of low pH, which dissolves the calcium and phosphate out of the teeth.
Right.
So it's really a disease of pH.
Disease of pH. So then you develop products to help us control that pH.
Yep.
Carifree.
Right.
Okay. And extremely effective.
Right.
The problem was that to get the patients to continue to use because we've experienced that in our office. We've had many people use it. Fantastic results we're seeing, and then they'd go off and stop using it.
Right. It's like I don't need it anymore.
Now the final piece of the puzzle is
trying to get them to see this as a long or a sustainable behavioral change, right? A lifelong change.
Right.
So I can get somebody to change their behavior as a dentist in the short term, but like 6 months or 9 months from now, we're back to square one because they did it for a month and then they quit.
Yeah.
And so it's really understanding what does it take, how can I help that person sustain that behavioral change in their life, and that really comes down to wellness coaching. Those are specific skills and communication tools that exist. We just were never trained to do that.
Okay, fantastic. Kim, thank you so much
for
being
with us.
Hey Mike,
thanks for being here. Yeah, I appreciate it.
Okay.